budget coverage on the land. My name is O'Brien. Well, the government has set aside 14.3 billion shillings in the financial year 2021-2022 to facilitate a further rollout of the COVID-19 vaccine. In the 3.66 trillion shillings budget presented by National Treasury Cabinet Secretary Ukur Yatani, the government has allocated 8.7 billion shillings to the COVID-19 emergency response project and introduced value-added tax exemptions on various pharmaceutical products and medical equipment.
With over 1 million Kenyans having received the first dose of COVID-19 vaccine by end of May 2021, the government is planning to spend 14.3 billion shillings in the financial year 2021-2022 for the purchase and rollout of the COVID-19 vaccines.
In order to facilitate further rollout of vaccines to create herd immunity, we propose to allocate Kenya shilling 14.3 billion in the financial 2021-22. This is in addition to Kenya shilling 7.6 billion appropriated in the current budget.
According to National Treasury Cabinet Secretary Ukur Yatani, out of the whopping 121.1 billion shillings allocated to improve health services across the country, 8.7 billion shillings will go to the COVID-19 emergency response project.
The outbreak and rapid spread of the COVID-19 pandemic necessitated an urgent need to upscale implementation of universal health coverage to all our counties. Towards this end, Mr. Speaker, I have proposed an allocation of Kenya shilling 121.1 billion to the health sector to support the various programs aimed at improving health outcomes. Mr. Speaker, of this amount, Kenya shilling 47.7 billion will fund activities and programs for the attainment of universal health coverage. Mr. Speaker, specific allocations for the various activities and programs includes Kenya shilling 8.7 billion for the Kenya COVID-19 Emergency Response Project, Kenya shilling 4.1 billion for free maternity health care, Kenya shilling 7.2 billion for the managed equipment services.
In a move to enhance affordable medical and equipment for management of COVID-19 and other chronic diseases, the government has introduced tax relief measures on various pharmaceutical products and medical equipment.
I propose to introduce VAT exemption on medicaments used in our health facilities, including decongestants and food supplements. Further, I propose to provide VAT exemptions to diagnostic and laboratory reagents, artificial respirators, including therapeutic respiration apparatus, breathing appliances, gas masks, as well as medical equipment and technologies used in the provision of medical care services. It is my hope that the suppliers of this medicament and medical equipment will reciprocate by making their prices affordable.
The government has also set aside 1.2 billion shillings for recruitment of health workers, 7.2 billion shillings for the management of equipment services, and 1.8 billion shillings for medical cover for the elderly and people living with disability. Ben Chumba, reporting for Channel 1 News.